My specialty is pediatric cardiology, and the main reason I went into medicine fundamentally is to help people, to develop relationships with patients and their families, and to use those relationships to help them in times of need. I went into pediatric cardiology probably at least in part because my younger sister was born with congenital heart disease. She had 3 surgeries before she was 7 years old. And particularly for that last surgery, I could really understand what she was going through and the gravity of her situation. She's doing fine now. We're still very, very close, but I think that early experience was one of the major reasons why I decided to go into pediatric cardiology, to be able to help people and families like my sister and my family. The most important part of my philosophy of care is compassion, making sure that we treat patients and their families with the utmost compassion. Another thing that's very important to me is making sure we use all of the available data and literature to make the best decisions possible for our patients. I hope that people will say about me when they leave the office that he was a kind, compassionate doctor who listened to us and gave us all the information that we needed. The mission of our practice is to make a lasting impact on patients and their families, to help them to understand their disease processes if they have any, so that we can partner and make the best decisions possible. The most rewarding part of my work is the relationships that I'm able to build with colleagues, with staff, but most importantly with patients and their families.